Hello, guys. Good evening. Welcome to this week's edition of Let's Talk. I am Juju, and I'm joining you live from my kitchen tonight. So come on in, guys. Come on in, and we are going to have an important discussion about breast cancer awareness. And I know that everyone is gone pink and they're wearing their colors, but we want to talk about what it means. How does it impact you personally? What can you do if you have been impacted? How do you know if you're dealing with it? When should you start your screening? What does screening entail? All of those different good things. So, come on in, come on in, come on in, and invite a friend. Let them know that Juju is on the air. When you come in, if you would, please do me a favor. Please like and share this live. Like and share this live video with your friends. Tag someone, tag your bestie ladies, men, tag your wives, daughters, sisters, mothers, and let them know that we are having this very important discussion. So, guys, come on in. When you come in, let me know that you are here with me, that you are joining tonight's discussion. And also, I want you all to feel free tonight to make your comments as you see fit, ask any questions that you may have. And if you are an individual who has dealt with breast cancer or are currently dealing with breast cancer, we would love to hear from you. So come on in, guys. Come on in and like and share this video as you come in. I don't know about you all, but I thoroughly enjoyed the rain this morning. Good. Uh, it was some good rain. Now turning this down. It was some good rain this morning. And I just was able to sit on my porch and meditate a while and enjoy the raindrops and just just set the tone for the day. Hello, Miss Jackson. How are you
Well,
doing?
good evening, my sister. I am good. How are you?
I'm doing fabulous, Mr. Jackson. I am doing absolutely
Well,
fabulous.
you know what? I'm out of order tonight because I was supposed to put on pink. I had pink on, and then I had a situation to come up, and I started to go back and get another pink outfit. But you know what? People know I love and celebrate pink for the
Yes.
reason, so they know my heart. But typically, I would have been in order. But no worries. How
No
are you today?
worries.
How
No
are you
worries
today?
at all. I am fabulous. I have on my pink because we wore pink today at church. So,
We did well. We didn't wear pink, but I wore pink today
oh,
because
okay.
I really wanted to um, do that because I felt compelled to do it. I just felt it in my spirit, and I wore pink today. And there were several other men in the church,
Uh,
but it was our men's day, and the color was
okay.
blue.
Oh,
It was
okay.
blue, but there were several of us that had on pink.
Had on
So
some pink. Okay.
absolutely,
All right.
absolutely.
Miss Darlene Todd, hello. I saw you earlier today, and I'm sorry I can't see that far, and I didn't recognize your vehicle. And so when I saw you, I didn't know who you were until Miss Shirley Lyles said, that's Darlene, she's speaking to you. I said, oh, yes, that's my doll. I know I'll see her tonight because she's always here with us. Always. And put on
So
some pink. Okay. Definitely
absolutely,
appreciate it.
absolutely.
That's my doll. I know I'll see her tonight because she's. But yes, I definitely appreciate your constant support. So, hello, Anasha Ross. How are you doing? Thank you for joining us. Um, And like I said earlier, if you guys would please like the video, like the live, and share it with your friends and let them know that we are on the air. We're going to go ahead and get started. I'm of course this is Let's Talk, and I am Juju. We're coming to you live from my kitchen. Of course, I have with me my dear friend, my co-host, my producer, my ride or die, my one call that's all, Mr. Jerry Jackson. If ain't
Indeed.
nobody else got my back, Mr. Jackson got my back. It don't even matter how crazy my idea is, child, because I can come up with some. Now, sometimes he says, "Now, Julia, have you taken that pill?" Now, sometimes he will ask me if I'm taking my medication, but other than that, he usually goes on right along with it. But anyway, good evening, Miss Althea Thomas. Thank you for joining us. But tonight, as that all of you know, most of you know, October is Breast Cancer Awareness Month. It's the month that we set aside to bring awareness and about breast cancer and its impact on the lives of women and men. Um, in this nation and in this world. And we focus on treatments, we focus on cures, we focus on uh, screenings and preventative measures. So that's what we are doing this month, and that's what we're doing tonight. And tonight we were scheduled to have a special guest with us, and she was going to tell about her own battle with breast cancer. Unfortunately, she's not feeling well tonight, so we're gonna all pray for Sister Jeanette Peters and pray that she has a very speedy recovery. But like they always say, the show must go on. So what you have here is myself and Mr. Jackson, and we're going to share some information with you. And then we're also very willing to share this platform with any woman or man who is a breast cancer survivor and would like to share their story on tonight. Okay, so we're going to go ahead and we're going to get started. Hey, Jasmine Taz, how are you doing? Um, and Mr. Jackson, of course, if you keep, well, you gonna keep up with the comments because I can't see that far to read them on my screen, and they're not popping up for some reason on this other phone.
Yeah,
But anyway.
they're popping up, so I'm okay over here for now, unless something hazardous happens. I think we'll be good.
Okay, all righty then. Very good. Okay, so Mr. Jackson, I know you had some overall statistics about breast cancer, and we're just gonna go ahead and let you share those, and then I'll
Absolutely,
do some that are specific to Black women.
absolutely. But before I share the statistical data, I just want to say thank you to all of you that constantly come on and support us, but especially when we're talking about health. And it's just not my health, Julia Ardine's health, it's all of our health. This is something to really help us. And I really am so thankful that I had an opportunity to walk with my sister in the law, Liddell Hughley Jackson, who
Mhm.
was a breast cancer survivor for 10 years. She
Okay.
fought and fought and fought and finally succumbed to the horrendous, tumultuous disease.
Mhm.
Um, and, I'm here to support her, and I'm sure everyone in our audience, including Julia and I, we know someone personally that has struggled with breast cancer or is a survivor. And hats off to you and thanking God for his continuing healing and providing you with strength. And with all of that, I wanted to share some of the statistical data. Um, there are one in there is 1 in 8 women
Mm-hmm.
In the United States that will be diagnosed with breast cancer in their lifetime. In 2025, an estimated 316,950 women and 2,500 men will be diagnosed with invasive breast cancer. Um, the mortality, about 42,170 women and 510 men are
Mm-hmm.
expected to die from breast cancer in 2025. However, the survival rates tell us that when detected earlier at a localized stage, the 5 year survival rate is 99%.
That's awesome.
Now, here is what's alarming: the disparities.
Mm-hmm.
Black women are 40% more likely to die from breast cancer than white women, despite having a lower incidence rate. That
Mm-hmm.
is alarming, and
Mm-hmm.
which goes back to the disparity in healthcare for different cultures, races. It is very uh, disparaging. And so I wanted to share that statistical data. Um, I Before we get into a lot of other pieces of information, we've got to do a better care of caring for ourselves. We've got to do a better job.
Mm-hmm.
And, you know, our bodies really talk to us and they tell us things, but we're so busy that we forget about what our body is telling us. And if it's not right, we need to check on it. Just like when I tell you, check on your strong friends. It's
Mm-hmm.
just like in our bodies when we feel something or something doesn't sound right, or you see something bulging out, or something that just doesn't look right, we need to start getting it looked at immediately because
Mm-hmm.
early detection is always going to be a winner for us. So that's my thought, and those are my statistical data that I wanted to share for 2025.
All right, and I wanted to go back and I wanted to ditto what you said about early detection. And that's with any disease that you may have. Any disease, whether it's cancer, whether it's kidney failure, whether it's diabetes, whether it's heart disease, whether it is high blood pressure, early detection is the best thing. If we can prevent it, we want to prevent it. But if we can detect it early, and our cars have those check engine lights. Well, no better machine has ever been built than the human body. And God put all that stuff in us. We have check engine lights. We just like sometimes with the car, because with one of my cars, the check engine light been on for a couple of months now, and I ain't took it to the shop yet. And so sometimes when our check engine light goes off in our bodies, we ignore it. We know something's not right. We know we are more fatigued than normal. We know we have swelling that is abnormal. We know our breathing is labored. We know we feel something a little different in our breast. We know we have a discharge from our breast, but we ignore those things, and then they get worse and worse. It's not like, if I cover up my head, it's gonna go away. No, it's not gonna go away. So we do need to go, as Mr. Jackson said, get seen about. Go to the doctor, get checkups. But we should be doing our annual checkups anyway, and following the guidances and the recommendations for our screenings, and how often we should get screened, and when we should get these screenings. And so with the breast cancer, let's look at the suggestion for screenings. Well, first of all, let's look at the warning signs, those check engine lights. that God has put in our body to let us know new lumps in the breast or underarm, armpit. Sometimes you have lumps. Sometimes you may have swollen lymph nodes under your armpits, thickening or swelling in part of the breast, irritation or dimpling in the breast skin, redness or flaky skin in the nipple area of the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than the breast milk, including blood, any change in the size or the shape of the blood, and any pain in any area of your breast. So, if you have any of those signs, and keep in mind, just because you have some of those symptoms or any of those symptoms doesn't necessarily mean that you have cancer, but it is an indication that you need to go and see a medical professional. Okay, and so I want to put forth a question. Why are we as Black people sometimes so hesitant to go to the doctor when we have symptoms or when we know something is not right? We're not feeling our best, or we feel like something may be going on in our body. We're hesitant to go to see a physician. And I want to ask the question to the audience out there: why are we hesitant sometimes to go see a physician? Minister
And
Jefferson.
and Julia, I can only speak from personal experience.
Mm-hmm.
We are afraid of the unadulterated truth, and we don't want to face the fact that
Mm-hmm.
something is not right, not realizing that the sooner we go, and if we have a regiment of going to the doctor, we can get ahead of those illnesses and um, the things that may not be going on correctly with our bodies, because a lot of times things lie dormant in our body, and with the proper testing and um, talking to the doctor and sharing information. I know that a lot of times when we go to the doctor, we expect the doctor to read our minds.
Mm-hmm.
And, the doctor or the nurse would say, "Well, what's going on, Mr.
Right.
Jackson? Tell me what's going on." And I love my cardiologist. I love my regular practitioner. I just, because when I don't give them enough information, then they go a little bit deeper and they say, "Well, when you say such and such, tell me a little bit more about that."
Mm-hmm.
Or, and then they dig a little bit deeper and they ask these open ended questions, which eventually and initially will allow them to hear some of my concerns without me thinking that they're interrogating me. But back to the point, we are afraid of the unknown.
Mm-hmm.
Uh, and I don't know why we're conditioned to do that, because the human being, I think our mind is always saying, well, it's going to get better. Even when we start out with the sniffles, we'll
Mm-hmm.
say, well, I'm just going to wait and see what's happening. Let me just take some vitamin C.
Mm-hmm.
But just because you're sniffling doesn't mean that it could be a sinus issue. It could be something a whole lot more severe or serious. But because we want to self diagnose ourselves, we'll do self medication, and we'll think taking a Tylenol to appease or mitigate the pain will fix it. But if you're continuing to be in pain, that's an issue. But we are afraid of what's the unknown and really seeing about ourselves. And once we do go, we go when it's absolutely necessity, when we're in so much
Situation
excruciating
critical.
pain,
Mm-hmm.
right, where
Mm-hmm.
it's critical. So
Mhm.
I'm watching the chat to see if anybody has posted anything, and no one has posted anything yet. We're still
What?
waiting
Okay. But
to
well,
hear.
let me ask you, Mr. Jackson, about this then.
Sure.
Do you think because, we as Black people tend to be more conservative in nature, and most of us consider ourselves Christian and have a faith in God, do you think that sometimes people have been taught that if they seek medical attention, then they don't have faith in God?
I love that question. And, um, you know, I advocate going to see a professional.
Mm-hmm.
As a Christian and a hardcore believer, one who has a personal relationship with my Savior has given me free will and given me a mind, but he's also given me the ability to pray, the ability to trust him. But in all of those, he also says you need to seek professional help because I can't fix my own body. And God ordains those medical professionals. He will send you the necessary help that you need in order to mitigate those issues or give you some education or knowledge about what's going on in your body. I have to speak to my body because the first part of healing starts with me. I can
Mm-hmm.
speak to it, but I can't fix it. I believe that God is the orchestrator and he can take care of all of my needs. But he also said, I gave you medical professionals. He's given me everything that I need in order to get what I need to fix what's going on. Now, there are some people will say, well, you're not a Christian if you go and seek a third party um, opinion about your body. Well, I beg to differ
Mm-hmm.
because there were medical professionals in the scripture in the biblical days. And
One of which was a disciple. Luke was a medical doctor.
absolutely,
Okay, go ahead.
absolutely. And if here is my thought process, and anybody that wants to debate me, I'm here for it. I always believe that healing comes in two forms. You can be healed on this side, or you can be healed when you leave this earth because you're no longer experiencing those issues, concerns, or whatever it is. We know that we can't stay here forever, but back to your question, a lot of people have been taught that if I seek a third party by going to a medical doctor, then I do not trust God. And
Okay.
that is the biggest myth that I've ever heard of because I trusted God when I was going through my severe illness. And I know
Mhm.
that it was nobody but God that brought me through, but He used the hands of those medical professionals to do what they needed to do to figure out what was going on with me and to give me the proper medications that I need. It is my goal to come off of medication. It is my goal to lose the weight. I'm working very diligently trying to get some of this weight off. I'm trying to do it the right way. And let me tell you, do I want to have surgery? Yes. Do I want to take a shot? Yes. I want to do all of that because my mind and we as human beings are into instantaneous fixes. But unfortunately, the Christian base will tell people that if you go and seek medical professionals, then you're not really a Christian.
Okay. All righty then. Okay, so we'll move right along. Do we have any comments at this time?
Nothing in the comments, and I'm
Wait
here
a
for it.
minute.
I'm just loving the
You don't
dialogue.
see anything? I see something from Miss Annie Baker Marbury and from Darlene Todd. They're
Okay,
not coming
yes,
up.
I do see
Okay,
something from
okay.
Andy Marbury. Yes, um, Good evening, Miss Marbury. She says two of her sisters died from cancer. One was
Okay.
cancer free for 25 to 39 years, but she died later from lung cancer. The other died from stomach cancer. Early detection is definitely necessary. I totally agree with you. Thank you, Miss Marbury. Um,
Mhm.
Darlene Todd says, my doctor calls me Hollywood Todd because I always call and make an appointment if something is different with me and my body, and I will show up without one if needed to be. I love that. Thank you. Thank you so much, doll. And Anna Marbury says, some people don't have medical insurance, therefore they're hesitant to go. I want to talk
Yes.
about that a little bit later in the
Okay.
conversation, but oh my
Okay.
gosh, you're absolutely correct. And thank you for all of those wonderful comments.
Okay.
Um,
Okay, so moving right along here, we were talking about the symptoms, and so now let us look at the screening recommendations because we're saying you need to go to the doctor, make sure you're getting your screenings and everything for breast cancer. Breast cancer screenings mean you're checking a woman's breast for cancer before there are signs or symptoms of the disease. Your health care provider will give you your screening options. And then they'll tell you, what are the benefits, what are the risks associated with it. And you and your doctor make your decision on what is best for you. Um, Although breast cancer screening cannot prevent breast cancer, it can help find breast cancer at an early stage where it's more more curable. Like Mr. Jackson said, if it's caught in a very early stage, the survival rate past 5 years is like 99%. Um, and so if you catch it earlier, it's easier to treat. And so make sure that you do talk to your doctor. The U.S. Preventative Services Task Force is an organization that looks at diseases and tries to see how to prevent, when to start screening or whatever. But the task force recommendation is that women who are 40 to 74 years old and are at, excuse me, y'all, average risk for breast cancer should get a mammogram every 2 years. Women should weigh the benefits and the risk of the screening test. A different screening recommendation may be used for women who have a higher than average risk. And so we need to make sure that when we are dealing with our doctors and then we are talking about screenings and how often we should get them and when we should start, that we know the doctor has assessed our risk level. Because for me personally, I have dense tissue in my breast. So that means I'm at a higher risk. And plus, I have never had children. Never understood because I'm not a medical professional why that puts you at a higher risk of having breast cancer, but it does. So because of my dense tissue in the breast and because I have never had kids, I'm at a higher risk. Ooh, excuse me, y'all. I'm sorry. Can't drink these colds. I'm trying to get the blood sugar down, so I just anyway. Um, so that means that for me, my doctor and my insurance recommends that I have a mammogram once a year and an MRI once a year. So that means that I have a mammogram, then 6 months later, I'll have an MRI. Then 6 months later, I have another mammogram. 6 months later, I have another MRI. So it rotates like that with me. So although these are your standard recommendations, you need to make sure that you are communicating with your doctor to know what your medical professional recommends for you as far as the different screenings are concerned. Okay. And so and then also we know that we should do our monthly. Every woman should be doing monthly self breast exams. And that's just feeling for lumps or changes in your breast that you can feel with your hands, and that all of us should do on a monthly basis.
Wonderful. Well,
Okay.
thank you so much. And that goes back to DNA, how you're made up, how your body chemistry, all of that determines how regimented you need to be able to get your exams. We've got several comments.
Okay.
Beverly Diane Adcock says that her grandmother and her sister all had breast cancer. She's saying
Oh,
her doctor has put her down about my procrastinating on a mammogram. She's going to have her mammogram next month.
okay.
Um,
And then Diane Adcock, let me say this because Miss Marbury was talking about people not having insurance. The breast treatment center at the medical center at Auburn, they are giving free mammograms on I mean, excuse me, the 31st of this month. You do have to make an appointment, but that's for anybody. If you don't have insurance and you need a mammogram, have not had one, you can get one free there. Do please call them. That's at the Auburn University Clinic, the campus at Auburn University campus of East Alabama Medical Center, where they have the breast center there. They will be doing free mammograms on the 31st.
Thank you so much for that wonderful information, and we'll post that in the chat.
Okay.
Darlene said that her best friend battled breast cancer for 10 years and lost her battle in 2010. And Beverly Adcock says, it's contagious. You got me yawning, ma'am.
I'm sorry.
Your yawns are contagious. And I'm surprised I have a yawn because typically, as soon as a yawn comes across my appearance, I start yawning. But we still love you. We understand.
I am so sorry. I usually can have me a cold, but y'all, my blood sugar is. We talking about breast cancer today, but we need to talk about diabetes because my blood sugar was registering 320 something when I started this show. So I got to stop drinking those sodas. I got to do that.
Well, you're welcome, Miss Marbury. That's what we're here for. Let's Talk is to provide Bible information to all of our people. We're here about hope. Hope is helping our people every day, and that's what we want to do. So thank you for always being a person in our audience and
Yeah,
participating.
and
Really,
participating. Yes,
we-
because
we-
your participation makes the show. I mean,
absolutely,
me and Mr.
absolutely.
Jackson just here talking to each other. That don't. But when the audience gets involved, that makes the show.
Yes, it does. It makes it absolutely very, when it's engaging, it's
Mm-hmm.
everybody gets something out of it.
Mm-hmm. Yeah. All righty then.
I did post, and thank you, Miss Marbury. I did post in the comments if you know of anyone that has breast cancer that is surviving, that's going through treatment, that you would love to share with us, we would like to call their name.
Mm-hmm.
And we would like to acknowledge them because um, within itself, having the diagnosis is one thing, but the mental part and the psychological anguish that goes with it is something we probably would never be able to understand. So if you know someone, uh, place their name in chat. Don't be afraid if you don't mind. Some people don't want to share, and I need to make amends to something. Um, I just now figured out that I made an error um, in communicating with our particular guest. There was a mix up, and I'll take total onus for that mix up. I just found out, so
Okay.
I have to come clean.
Um,
Of course, um, the guest is having may not be feeling well, but I think I have some. I'll take onus of some other portions of that, but I want to publicly apologize about that, and I won't get into the details. But
Okay.
I needed to take onus of that, okay?
Okay.
Because I just found out some information. So
Okay. Okay.
apologize. I apologize, my Let's Talk family and friends. I love you. Thank you for your forgiveness.
No, oh, no problem. We all have slip ups and faux pas. Okay.
Yes,
That is
absolutely.
part of life.
It's
All
part of
right.
life.
Okay. And so we want to look at, we talked about the statistics in general, but we wanted to look at Black people, Black women in particular. And Mr. Jackson touched on this when he was giving out the statistics, but it says that Black women experience a significantly higher breast cancer death rate compared to white women, with a disparity of approximately 40%, 40 to 42%. They are 40 to 42% more likely to die of breast cancer than their white counterparts. And if they're diagnosed at a younger age, they are twice as likely to die from breast cancer than their white counterparts. Um, uh, and what we're talking about is the mortality rates. Like I said, they are 40% more likely, even though Black women are 4% less likely to have a breast cancer diagnosis at all. But they're more likely to die if they do have that um, diagnosis. And some of the contributing factors to this is socioeconomic disparities, like Ms. Marbury was saying, they don't have a regular doctor, they don't have a gynecologist that they see, they don't have insurance, they can't afford to go to the doctor, they can't afford the cost of the test. A lot of this was addressed that people didn't realize was addressed in the Affordable Care Act, like mammograms. Every woman, I think, over the age of 40 under the Affordable Care Act should receive one free mammogram per year. Okay, and you shouldn't have to pay for that. And if you're going to a doctor and they're charging you for a mammogram, if you're over 40, then you need to bring that to their attention. Now, we do realize that Republicans are working hard to repeal parts of the Affordable Care Act and to dismantle it piece by piece. But right now, that breast cancer and that Pap smear, those you should be able to receive those annually. Um, for free. But we have to know about these things. Knowledge is power. So we have to make sure we know. If I don't know that that exists for me, then I'm thinking I can't afford it. I'm not going to go and get it. And so we have to know that it does exist. And our information flow in the Black community is not the same that it is in the white community when it comes to stuff
Absolutely.
like that. We share other stuff, but when it comes to this important life saving information, it doesn't flow through our community like it flows through other communities.
Very good. We've got some names. Annie Marbury wanted to pay
Okay.
homage to Carolyn Glaze Wilson and Judy Finley.
Okay.
She shared that Carolyn Glaze Finley is a breast cancer survivor, and Judy Finley is a stage 4 cancer survivor. And Darlene, our doll baby, says that you may want to try Diet Coke, okay?
Okay.
Um, So that will help you. And then she said, you may want to drink plenty of water. Okay, so
Yeah,
um,
I'm drinking my water. Thank you, doll. I've got to find a diet soda that I can like because I don't do coffee, so I need to get my caffeine some kind of way. But
well,
anyway.
Coke Zero, that Coke Zero is the best thing that I found that was better than any of the Diet Cokes, the dark ones, because it doesn't leave that terrible aftertaste. And
Mm-hmm.
I know my brother-in-law just lives by that diet, that Coke Zero, and my bestie, best first cousin sister, Mary Julia Johnson,
Uh-huh.
she loves a Coke Zero. That's
Coke
all she
Zero.
wants.
Okay.
So
Okay.
I would ask you to give that a try. Even I like a Coke Zero, and it, but I'm really trying. My nemesis is sweet tea.
Me too.
Uh,
So
I have
yeah.
a problem with that, but I don't like it really really sweet. And here in Georgia, the tea is just like sugar. But my bestie, one of my childhood besties, Rochelle Snipes, we had dinner the other night, and she told me, she said, "Don't get any more tea. You don't need any more tea." I said, "I've only had two glasses." And she said, "You don't need all that sugar." But you know what I love about them? I got two sister friends
Mm-hmm.
that have my best interest at hand. Like, I was sniffing, and she gave me something to wipe my nose. She said, "I don't want you to get sick." And
Mm-hmm.
I know I'm going a little bit off the subject, but I'm getting to the point of support. You've got to have that support, or that village, is that will encourage you, just like Doll said, drink Diet Coke. Or you telling me, Mr. Jackson, did you go get that checked out? That's the type of support that we really need. And I just love them for that, because they truly care about me. And
Mm-hmm.
I made the statement. I said, we're true to one another. And I
Okay.
meant that in all sincerity, just like how we are, Julia, and
Uh-huh.
the family, how we are going to be that village and be so supportive. But during breast cancer or in any type of illness, your positivity and how you have hope about your situation helps out a lot. If you know that you can beat this, you're going to live longer, because we're going to go away from here with something. Something's going to take us out.
Nobody gets out of here alive, do they?
No, no one. But it's always a beautiful thing when you have that supporting village. Even if it's nothing but to come over and just sit with you and just look at you and just smile with you, that's more than sometimes medicine can give you. But it's all about how your outlook. And I have hope about everything. Everything that I encounter, I have hope.
You approach it with
Will
hope.
will it end the way that I want it to end? I can't determine that. But when I look at the navigation of every piece of life, it always ends in a positive situation, because you think about, if I am in pain every day of my life and then I go to sleep in the Lord, I have been healed. I
Mm-hmm.
just feel that way.
Mm-hmm.
So I
I,
appreciate that. And
okay.
Darlene Todd says, you can do Coke Zero or diet caffeine, caffeine free. And she says she's going to make all of us her village. And we've got a message from Nietzsche Wines. Um, Miss Julia, Poppy are good. A substitute for soda too. I don't know. So thank you for that, Nietzsche
Okay.
Wines. We
Okay.
appreciate that.
Okay.
Thank you.
But anyway, and I wanted to get back to the disparity among black women because I have a question that I want to ask. They do say that black women have more comorbidities that go along with if they have cancer and high blood pressure, cancer and heart disease, cancer and diabetes, then they are more likely to the cancer is more likely to be of fatal. They're more likely to die of the cancer if they have these comorbidities, and black women have more comorbidities than white women, the obesity and all of this. Biological differences, it says that some studies do show that black women tend to have a more aggressive form of breast cancer. They are more likely to have a more aggressive form of breast cancer than white women. And then the other one is the delay in diagnosis. We don't get the early detection, which leads to the higher survival rates. And we are oftentimes, like I said, situation critical before we are diagnosed, and we're at stage 3, stage 4, where the survival rates are considerably lower. But anyway, so um, the higher rates of breast cancer death among Black women are a complex issue influenced by a combination of economic, healthcare access, systematic factors. Addressing these disparities require targeted intervention at multiple levels, including healthcare systems, community support, and policy changes to ensure equitable care for all women. So, my question is, what role do you think systematic racism plays in the disparity in survival rates between Black and white women diagnosed with breast cancer? Do you think systematic racism plays a role? And if so, what role do you think it plays?
Hmm. That I love that question. As I read data, listening to podcasts, the medical professionals, um, it is a daunting. It's daunting data that's out there that's saying um, systemic racism is a problem, and it's not intentional racism. But when you are dealing with our bodies and who we are conditioned to not share everything. And we become what is called a statistic. We're just a number. You came in, we're going to do the least we need to do to say that we did test you, blah, blah, this, or we listened to you, but are we going to do everything medically necessary to help us? We will, the medical professions will say, you came into the office and we did this. They're going to minimalize everything that they do unless we have advocacy or we're going to advocate for
For
ourselves.
ourselves, and
So,
and be demanding. And
right,
like Doll said, when you're dealing with your doctor, sometimes you got to push, sometimes you got to, and I have done that myself. Called and called and called to the doctor and never got a response. I said, okay, I'm just gonna walk in. And Doctor don't take walk-ins, but he gonna take one today. Okay. And so, but what I have heard in different discussions and panels about breast cancer is I've there have been panels where you have Black and white women and they have the same diagnosis. Okay, stage 1 whatever cancer, you have a lump in your breast, it doesn't seem to have spread, da 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 da, but the recommendations from the doctors are totally different. For a Black woman, they may say, okay, we're just going to do a mastectomy. We're going to cut this lump out. I mean, we're going to do a lumpectomy. We're just going to cut this lump out. And then we may or may not do chemotherapy, radiation, da 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 da. For the white woman, the suggestion will be remove the breast. Let's do a mastectomy. That way we know the breast cancer won't come back. Okay, so why do you have this? Why is that disparity in the treatment that is offered
Um,
to women who
well,
with the same diagnosis?
Julia, in the for some reason, I heard this on a panel, and it was just jaw dropping to me. Um, and I don't know how true this is. I don't know if it's a myth, but it was jaw dropping that black women don't want to have their breasts removed because it's going to affect how sexy they are. And
I,
believe it or not, um, a lot of
I have
women,
heard people, associate their femininity, their womanhood with their breasts. But how sexy is it? I mean, to be a young woman laying in a casket.
right?
How
And
sexy is
and
that?
we get our bodies done. We get these um,
Or even a young
enlargements.
mother laying in a casket.
Right, we get the enlargements to a lot of our body parts. So even if you have to have a mastectomy, I believe they can make you one that looks,
Yeah,
and
they make
nobody
them.
knows. And if you're married and your husband loves you or your mate loves you, they don't care whether or not you're not going to have a breast and it's not real.
Right.
They should be caring and loving you that you are surviving.
Right.
So
I'd
that's
rather
that's
have you without a breast than not have you, and you
and you don't
got
even
two.
have to have reconstruction surgery. You
Right.
can wear a bra that has pads in it that makes it look like you have a
And,
breast. So
and
um,
maybe, Mr. Jackson, I'm a woman of a certain age, so it don't matter to me. But if a doctor told me I had breast cancer, you can take both of them. You ain't got to put nothing else back here. I'm good.
I love that. So we've got a comment in the chat from Annie Marbury. She says, as African Americans, we settle on the fact that the first diagnosis is enough. Oh
Mm,
my God, you are
mm,
absolutely correct. We should
mm,
always seek a second or a third opinion or diagnosis. Let me tell
mm,
you something.
mm, mm.
You are absolutely on
Yes.
target, Miss
Yes.
Marbury.
Yes. Yes.
And we get so caught up in our medical professionals that um, we we trust everything that they say. But did you know that um, medicine is a practice and it's still subjective because we don't know everything. So it's always good to get a second opinion. I love my doctors, and when they tell me something, I'm going to ask a lot of questions, but I also know that I have a circle that I can go get a second opinion.
A
And
second opinion.
and somebody else will give you the same test. I mean, and you may have to battle with your insurance, but you can get the same diagnosis and go somewhere else and they have a totally different opinion. So now you're looking, you know, at either way. And Darlene Todd has said something comical in the chat. She says, I'm sexy and wear a double A cup, flat chested. Oh my God. But that's okay. And I see my classmate is on. I think I saw two of my classmates in here. I saw Frida Whitaker. Hey, Frida. Good evening.
Okay.
And hey, Wanda Rochelle Snipes. I saw two of my classmates in here, and I'm
Oh,
so
well,
glad of
welcome,
that.
ladies. Thank you for joining.
Absolutely, absolutely. Um, but you know, Julia, I know. Did you have some more questions before I continued?
No, I had that one, and I just wanted for us, and I wanted what Miss Marbury said for us to realize it's okay to get a second opinion, and it's okay. My doctor always tells me, he tells me all the time, I make recommendations. You're the patient. You tell me what you're going to do. I can only recommend. I can't make you do or not do anything. So at the end of the day, if you don't agree with what your doctor says, then you have a right. And a doctor may say, well, I'm not going to do that. Okay, I'm not going to do a mastectomy. That's fine. Thank you. I can go to someone else that will, but we have to study. It's bad. But when you get these kind of, you need to study and don't just go on the internet and just look at stuff out, all kinds of stuff out there, and half of it is not true. Okay, but go to reputable websites and do your studies, do your research, determine what's going to produce your best outcomes.
And Julia, I want to add to that the research. There are so many advocacy groups out here. Some are reputable, some are not. But all you have to do is just in your area, you can Google breast cancer support groups in Opelika, in Atlanta, in Montgomery, and it'll give you a plethora of lists so that you can get the support. Because I did, after your comment, I want to talk a little bit about support and advocacy because there are some things dealing with illnesses, medicinal illnesses, where support and advocacy play a huge part in survivorship.
Mm-hmm.
And I want to make sure that we are aware of those programs, how to go seek them, what to
Okay.
do, open your
Okay.
mouth, talk,
All
scream
right.
loud. And this is nothing against the church or a religious organization. Sometimes the church cannot help you except for to pray for you.
Mm-hmm.
If you're not receiving information about where can I go to get support or where can I go to get help other than praying and trusting God, it's more to being healed than praying and trusting God.
Okay.
Most of us are
Okay. Well, let me right quick, like
sure,
Mr. Jackson, before you go in there and give the risk factors for breast
sure,
cancer, and then we can just do the overall advocacy groups
yes.
and where to find them and what to look for. Okay, so the risk factors for breast cancer getting older. Most people are diagnosed after the age of 50. Genetic mutations. So if you have BRCA1s or BRCA2s, then you're at an increased risk of breast and ovarian cancer. Reproductive history. When you start your menstrual periods, if you start before 12, and if you start menopause after 55, then you have hormones, you're dealing with hormones longer, which cause a greater risk of breast cancer. Having dense breasts, like I told you guys, that's why I have to do the mammogram and then the MRI. Personal history of breast cancer or certain non-cancerous breast disease. If you know, if you have a history in your family, so it's important that you know your family's medical history. Um, did your mother, did your sister, did your aunt have breast cancer? And then family history of breast and ovarian cancer, previous treatment using radiation therapy, women who have had radiation to the chest or the breast, um, are before the age of 30 are at a higher risk. Exposure to the drug DES. DES was given to some pregnant women in 1940s and 1971 to prevent miscarriages, so we shouldn't be dealing with that. Not being physically active, so exercise is always important. Being overweight or having obesity after menopause, so that general health is very important. Taking hormones, so, most of the time they suggest women over the age of 40 not take birth control pills, not use those hormones. And then you also have to have some women take hormones when they're going through menopause. So you have to weigh the risk and reward of taking those hormones. Your reproductive history, having your first pregnancy after 30, or not breastfeeding, or never having had a full term pregnancy can raise your risk of breast cancer. Drinking alcohol, studies have shown that women's risk of breast cancer increases with the more alcohol that you drink. And research also suggests other factors like smoking. I hope they don't include them cigars that we smoked after the
That
Tennessee.
we smoked last night. Okay.
I hope it don't include those cigars.
I didn't smoke one, but I was enjoying it. Okay, thanks.
Being exposed to chemicals that could cause cancer and change in other hormones due to night shift working. That's what I wanted to say. Women who work the night shift, it changes the hormones in their bodies, and that can increase their risk of having breast cancer. Did we know that? I don't know that I knew that. But anyway, so those are some of the risk factors associated with breast cancer. And Mr.
Wow.
Jackson, if you want to go ahead and talk about your advocacy right quick, because we are approaching the hour.
Absolutely.
Mm-hmm.
Julie, that information that you just provided was a jaw dropper. Thank you so much for that powerful information. We don't realize everything that causes everything to go chaotic in our bodies, and
Mm-hmm.
our mental capacity causes a lot of issues with our bodies. You know, when we're struggling with stress, you know, stressors cause all types of problems with our bodies. So if you can only imagine when you're diagnosed with, specifically me, congestive heart failure. I mean, I
Mm-hmm.
never heard of that, but when I found out how severe it was and that you just live with it for the rest of your life, that's a daunting diagnosis. But when you think about breast cancer and what the data has said about the longevity, the survivorship, it affects your mental status. So
Mm-hmm.
I have listed several advocacy groups in the chat, and I want you to take a look at them and, you know, sort of provide that information for your relatives, for you, or for your loved ones that you may know who may be battling. And I know that Julia and I, we're always out here trying to help everybody. We can't be all and be everything for everybody, but we can certainly help put the information out. So
Information out there.
support
Mm-hmm.
and advocacy are really important. So, the first thing, even though you've been diagnosed, we've got to make sure that we're getting the mental health along with the status of your diagnostics or your diagnosis cared for, because you're suffering with a physical issue and it's causing you to think, oh my God, it's going to increase your anxiety. It's going
Mm-hmm.
to increase a lot of
And
things which
depression,
may
yeah.
cause you to be
Mm-hmm.
depressed.
Mm-hmm.
So that is very important. I posted information in the chat about that, and community engagement. You know, when we go to the Think Pink walks and we go
Breast cancer
to
walk.
the
Mm-hmm.
breast cancer walks and we go to the Susan G. Komen runs, and that is really important to be out front supporting people. And, you know, when I know friends of mine that may be going through some things, I don't have to buy them anything. I can just call them up and say, I just want you to know I am concerned for you and I'm wishing you nothing but the best and I want you to get healed. And I submit and send those angels of comfort, protection, and healing over you. Check on people and become that advocate that you can. You don't have to be a doctor, just be there to support them. And, you know,
And Mr.
survival.
Jackson, you
Sure.
may go to the doctor with them. You don't be the doctor.
Yes.
I
Yes.
may need you to go to the doctor. I may need a ride. I may be too weak to drive to my treatment. Or I may just need you to hold my hand while I take my infusions, you know. So, yeah, we can always find a way to support it, and it doesn't always have to be financially. Um,
Absolutely. We get so caught up in I don't have any money. Money can't buy love. Hello. You just be there to support. And the last thing that I want to share is the theme for the Breast Cancer Awareness Month for 2025. Every story is unique. Every journey matters, emphasizing compassion, dignity, and support for all individuals affected by breast cancer. Every story is unique. Every journey
Right.
matters. So
Okay.
thank y'all so much for tuning in. I just can't believe where the time went. Julia, you
Mhm.
stole the time tonight, okay? I'm going to blame it on you. You stole the time.
I stole the
Uh,
time.
yeah,
I,
because it's so much jam-packed information, and we've posted some information in the chat, and we certainly want you to be supportive and take awareness and run with it. So we're going to end the show, but before we do that, it's time for our announcements.
right.
Correct?
Yes,
Okay.
sir.
All right. So of course, next Sunday we're going to be talking about at the current cost of college, do you think it is worth the investment? I cannot wait for that because, Julia, when we went to college, I think it was $1,300 a semester.
Little
I can remember
semester.
that. And we thought that was absolutely asinine.
And now
But
they're paying $20,000 and $30,000 per semester.
absolutely. And then
Okay.
for, for people in Georgia that's going to our alma mater, they're paying $40,000 a year just for tuition. Oh my God. But anyway,
Mm.
next, I want you to mark your calendars for some exciting events. November 2nd at 11 o'clock, I'm going to be bombarding you because my alma mater, Julia's alma mater, and a lot of us alma mater, the University of Alabama Afro American Gospel Choir, and their praise dancers will be the special guest during morning worship at the historic St. Luke AME Church, which is located at 1308 Auburn Street, Opelika. Of course, it is open to the public. And listen, y'all can miss going to your church one Sunday. Come on over
It's worth
there.
it. It's worth
It,
it.
it is because the young people are going to sing and dance and shout and give praise to the Lord. And then the next week we're gonna come on in and do what we need to do, and win that ball game. If you are looking for any Mary Kay makeup, we have a wonderful consultant in Joyce Thomas Vincent. She will be able to supply you with all of your Mary Kay products. And please, as I talk about the Mary Kay consultant, she also has a Divinely Guided podcast on YouTube that she does episodes every Monday. They drop about 6 o'clock p.m. Central Standard Time, and it's always a wonderful conversation that will enhance us and enhance our lives. And it features her and her daughter, Adrielle Vincent, and of course the mother, Duchess Thomas. Please continue to subscribe to Juju's Dollhouse on the YouTube channel. You'll be able to keep up with everything going on with By Juju for you. And you'll be able to catch any of these editions that you may have missed of Let's Talk.
Mhm.
And Juju is a proud sponsor of Hold Up the Light Huddle. Juju's just always cares for everybody. And Juju, we thank you so much for being such an advocate for the less fortunate.
Mr. Jackson, I have to thank God
I
for.
would you let me finish and then you can
Okay.
have yours, please? Uh-huh.
Okay.
But
Yes.
I want to give you some props, okay?
Okay.
Because I think a lot of times, and I fuss at you quite often, but I cannot stop what God has provisioned you to do. And I just appreciate and thank God for the love that you have for His people. It's unbelievable. I mean, how you, at the drop of a hat, will go above and beyond to take care of people and forget about yourself. And I just thank God for you and the gift that He's given to you. And I appreciate you. And I continue to say, always follow the heart that God has given you. And you know, it's nothing but love over here for you. How about that? I'll turn it back over to you.
And you know I love you, Mr. Jackson. Like I said, you always follow me. I say I'm gonna go get into the fiery furnace. You jump right in there with me, and
Yes.
so I appreciate that. But I thank God, and my prayer is always, Lord, strengthen me to do the things that you have ordained me to do. And so it's by the grace and the strength of God that I continue to try to help. And I have also prayed to enlarge my territory. And it's not about me, but I want to reach more people. I want to have a positive impact on more people. I want to leave this place called Earth a little bit better than it was when I got here, or at least leave the lives that I come in contact with, the people I come in contact with. I want to leave them better than they were when they met me. And
And
that is my
Julia,
heart's desire.
amen. Julia, I would be remiss if I didn't say hello to Andrew Page. He's one of our faithful listeners. And
Yes.
hey, Andrew, thank you so much for attending. We appreciate and love you so much.
That's
And
that's one of my Alabama alums and a brother
yes,
from another
yes,
mother. Yes, yes.
yes, yes. He just took me right in under his wings and just, oh my God, the times that we had at the University of Alabama is unmatched. And I will never, ever forget him for being so good to somebody, a country bumpkin like me,
Oh,
in a big old school. So thank you.
thank you. But
Let's see.
anyway, guys, we are going to go. I thank you guys so much for joining us each week, for taking time out of your very busy schedule when you could be doing something else and joining this conversation. And my prayer is that the information that we shared tonight be a blessing to someone out there. Someone can use it and it helps them as they are going and navigating through their life. So um, we pray God's blessing over this message the information that we put out. I am Juju. I am that mountain moving giant slayer. I'm walking by faith, I'm inspiring hope, and I'm showing love all along the way. Until next time, guys, I wish you all much love and many blessings. My heart is, I don't know if it's getting better or worse. But anyway, good night. Love you all. Y'all have a great one.